Today we're going to talk about the Synergie Clinical Rolling Protocol or collagen induction therapy, and we're going to be using the Synergie Practitioner Cliniroller. Now, collagen induction therapy is a fantastic treatment, and it's a really good alternative to what I believe to be stimulating collagen, working on the skin texture, working on scarring, and great alternative to fractional laser. You have less of an investment in the machine, and the disposables are a lot less as well. You're looking at the price of a roller being around $100 versus fractional laser, which we know is a lot more. You get the same results and you get less downtime with the client as well. So today we're going to discuss how this treatment works, and then we're going to go on to the actual procedure. So medical skin needling has been around for a while, but we've recently discovered that it has many far-reaching effects for the deep dermis, and it actually causes the fibroblasts to be stimulated. So what we're doing is the needle is actually penetrating right into the dermal layer, and it's stimulating those cells to produce more collagen, the fibroblasts, and elastin as well, and also stimulating growth factors to be released. So it sets up a massive cascade of repair for the skin, which works on the top layer to reduce fine lines and wrinkles, working on the texture of the skin and also acne scars. And how it works is these fine needles are actually creating physical injuries to the skin. Those physical injuries are very fine. The actual surface of the skin is really kept intact, but these injuries basically trick the skin into thinking it's had a massive injury when in fact it's only had pinprick injuries. And those injuries set up this cascade of events which causes healing and collagen regeneration. Now, I personally have had about 6 needling treatments. I think for my skin it's had a phenomenal effect on the tone and texture of my skin, which is why I firmly believe in using the Cliniroller as part of our procedure. I believe that 5 to 6 treatments minimum is best. If you've got deep pitted acne scarring, you're probably looking at about 10 to 12 treatments. Minimum time distance would be, say, 4 to 6 weeks apart. And the beauty of collagen induction therapy is this because the collagen is continually being stimulated, you see the results for months ongoing, and the best result is about 12 months from the first treatment. So it's cumulative effects. I would recommend that only medically trained staff do this procedure. If you are under a doctor, make sure that doctor covers you and supports you to do that procedure if you're a clinician. But we do only sell our Cliniroller to medical practices. Our rollers are 2 millimeters long. They're made of surgical steel and they are disposable. We only recommend this device be used for one treatment only. So you can see here we've got 2 millimeter needles. We'll show you the technique during the procedure, but they do penetrate right through deep into the papillary dermis to stimulate collagen. So we're going to go through the treatment now and discuss the fantastic results of collagen induction therapy. Thank you. We're going to be today doing the Synergie skin needling protocol, commonly referred to as collagen induction therapy, and we're going to be using the Synergie Practitioner Cliniroller. The Cliniroller has got 2 millimeter fine gauge needles, and these are only to be performed by a qualified medical therapist. So either a doctor or a registered nurse may perform these treatments. And how this works is these fine gauge needles actually produce tiny and thousands of tiny micro injuries in the skin. And it actually tricks the skin into thinking it's had massive injuries when in fact it's only had micro injuries. And through this, all the growth factors and collagen and fibroblast stimulation occurs, and you get a wonderful new collagen production in the skin. It's great for retexturizing the skin and evening out fine lines and wrinkles. And we've got our patient here today, Alison, and she's going to have a collagen induction therapy performed on her. So we are going to start with having the topical anesthetic cream has been applied on Alison's face. It's been on her face for about 1 hour. Now, depending on the anesthetic cream used, you may occlude it with Glad Wrap. Occasionally it may not need occlusion. And the longer you leave it, the deeper in the dermis it penetrates. Now, some clinicians like to work in sections of the skin and remove the numbing cream in sections. It's entirely up to the directions as per the numbing cream you use. So we've now occluded and we've now used the anesthetic cream on the client. Now we've already double cleansed Alison's face. So Katrina is actually removing the numbing cream now. and make sure we thoroughly remove all traces of the cream. It's very, very important to have a clean, prepped skin for this, and free of any potential bacteria. So following our double cleanse, we're also going to prepare it with a degreaser. The other great thing about the skin needling is you get a continuous improvement with the quality and the texture of the skin. So you see an immediate result after a few weeks, but the results continue to improve over 12 months. So the end point after your series of treatments is usually about 12 months after the first treatment. So we've just used chlorhexidine, which is a sterile cleansing solution as well. Katrina, explain why we want to use that.
Just to prep the skin so that you don't get any infections.
Yep, it's very, very important. This is a sterile procedure. Also, the Cliniroller is a single-use only system. We do dispose of the roller immediately afterwards for sterility reasons, and also because the needles do blunt after use, and it's certainly not as comfortable for the patient. So this is our sterile roller. We're just removing it now from the packaging. And we're going to commence the treatment. So the sterile Cliniroller is gently rolled over the face in sections. So Katrina, you can explain to us how we're going to be working in sections here.
So we just choose one part, about a business card size, and work the complete method through. So what you do is you hold the skin quite firm, place the roller on, not pushing it hard, but just placing it on the skin, and you roll it back and forth 4 times.
So we've got the horizontal pass, and
yep.
1 back and forth is 1.
Yep. And then here, 1, 2, 3, 4.
That's the vertical pass.
1, 2, 3, 4. There's not a lot of pressure, you're just guiding it through, and then we do 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. So I'm rolling into the eyebrow and into the hairline.
So about a business card area per section.
Now, that was light touch. You will get a little bit of blood spotting, but it's not bleeding. It's just the rollers. It's not aggressive treatment.
The pinpointing is actually a desired outcome because it means all the natural skin growth factors are being released. So we actually want that as an end point, don't we, Katrina?
Yes, 3, 4. And the deeper the scarring, the more you want to push and get more. So with stretch marks, you really want a lot of blood.
Yeah.
1, 2, 3, 4. 1, 2, 3, 4. 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Two, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4, 1, 2.
And that's the forehead completed. So now we're going to move on to the left side of Alison's face. And same protocol, credit card size, commencing with the cheek. Or the temple, I should say. Now, the more holes you create and the more little micro injuries you create, the more collagen will be produced. So an experienced therapist doing this treatment may do more than 4 passes back and forth, but as a commencement to the program, we do recommend a minimum of 4 passes back and forth horizontally, vertically and obliquely in both directions.
If they're feeling it and it's very sensitive, which it can be, you can do smaller areas.
Okay.
And that makes it more tolerable.
The other thing you can do, especially around the perioral area, which can be very sensitive, you can administer a nerve block via injection, and obviously only a medical therapist could do that, a doctor or a registered nurse, but it does make the perioral area a lot more bearable.
And generally just a 2% lignocaine is fine,
Yeah.
xylocaine, yep. Coming up underneath the eye. Instruct the patient to keep their eyes closed.
Yes.
1, 2.
Obviously the closer we can get under the eye, the better, but we don't want to go too close.
Stretching the skin around the eye. 1, 2, 3, 4. 1, 4.
Now also remember, prior to doing any of these treatments, it's always mandatory for the client to sign a consent form. And some of the contraindications of collagen induction therapy, obviously we would never do needling over cystic acne or open acne, or anything that's actually obviously infected, open cuts or wounds. As a general rule, we don't treat pregnant or lactating women. We don't treat anyone with diabetes or anybody with inherent clotting disorders, anybody on warfarin, and also anyone prone to keloid scarring. It's generally a very safe procedure. Anybody, any Fitzpatrick can do it, from Fitzpatrick 1 up, right up until Fitzpatrick 6. There is no risk of post-inflammatory hyperpigmentation and virtually zero risk of infection if it's done under sterile conditions and the instrument is disposed of immediately. And we do use the chlorhexidine to maintain sterile conditions as well. So we can see the systematic approach that we're taking to this procedure. And we do recommend having treatments at least every 6 weeks, up to every 8 weeks. And the magic number of treatments to have is usually 6 to address fine lines, and up to 8 to address deep acne scarring. It's fantastic for pock scarring and any form of scarring on the face.
Onto the eye area.
Now we're doing both sides of the face. Okay, we're just going to do the chin area, again systematically working across and going as closely as we can to the vermilion border. You can actually go over the vermilion border, and it's really important to do the lips thoroughly because obviously we get those fine vertical perioral lines as we age, and skin needling really addresses those fine lines around the lips. It's often seen as a really good alternative to CO2 or erbium laser if you have successive treatments. Now this process can take anywhere from 30 minutes for a very straightforward procedure, right up to 45 minutes if the client has very deep wrinkles or deeper scarring. So depending on the experience of the clinician and the needs of the client, it can be up to 45-minute procedure. The trick is to be systematic in your approach to needling and work in sections and be thorough with your passes. And also maintain even pressure over the face. If the client feels you've got uneven pressure, they won't feel confident under the needle. So practice and make sure that you've got nice even pressure on the client's face at all times. It's also a really good idea for the client to ask them to bring their own earbuds from their iPhones, and they can actually put music on while they're having the treatment, because you can hear a faint sound of the skin popping while you're having the needling treatment, and it can be a little bit off-putting for a lot of clients. So just to sort of muffle out the noise a little bit, ask them to bring their headsets with them.
Is it expensive?
The treatment cost varies depending on the type of treatment, and some doctors do actually use a general anaesthetic, a very light general anaesthetic, anywhere between $300 a treatment to up to $600 to $700 a treatment, and we generally recommend anywhere between 4 to 8 treatments. So that we're doing the lips now. This is the most sensitive area of the face, but it is the most effective. So we need the patient to try and work through this. We need to work very quickly and very systematically and make sure that we cover the area just very close to the vermilion border, if not right on the vermilion border. And this is where you get the wonderful results after multiple treatments. Okay, so Alison has asked for extra passes over the lips, and she requires that because she's got a little bit of fine lining across the lip area. So Katrina's actually doing 6 passes. So the more punctures, obviously, the more collagen stimulation and the more fibroblast and growth factors being stimulated in that area. The skin begins to heal very quickly after the procedure, provided we occlude straight after. There is virtually negligible risk of infection as long as we follow the procedure and the protocol correctly. She's nearly done. This treatment is often seen as a very, very good alternative to Fraxel laser, and the benefit of this is you can do it on absolutely any Fitzpatrick, and you can even go over tattoos. Alison has tattooed eyebrows, so we can quite happily go over that. Even if she had tattooed lips, we still get the same great results. And obviously there's less disposables with needling in terms of cost.
So I'm just going to clean the skin now with normal saline. Sterile normal saline.
So this is just normal saline and gauze.
Yep. And this feels better as soon as it's done.
Very cooling and soothing.
So you sort of just let the saline soak into the skin for a second and then give it a little wipe. It's way lovely.
And then we can apply our active ingredients because the skin is very receptive. Now those micro holes are still open. So we can apply vitamin A serum, vitamin B serum, Vanish if the client has pigmentation. And these ingredients will be very, very actively taken up into the skin.
A nice thing to use is a dressing pack, a sterile dressing pack where you can open it up. Your container has little sections, of course, to put in your chlorhexidine, your normal saline, your sterile gauze, and your products, so that you're not having to touch bottles after the treatment.
We can see there is no more bleeding. The patient is virtually showing very little sign of bleeding after the procedure. Now we can apply our active serums. We're going to use A+, retinol molecular, so that'll help to stimulate the fibroblasts, regulate cell turnover, regulate the promotion of healthy blood vessels, and also help with any pigmentation. And then we can follow with a little bit of vitamin B as well, which helps to stimulate the immunity of the skin, increase the deep hydration of the skin by increasing ceramide production, and also addresses pigmentation and collagen. So we have a lovely healthy dose of vitamin B, much more so than you get normally, because we've created those micro injuries for the active uptake of the ingredient.
And the touch feels very nice after the treatment. It's very soothing.
Yep. And our final layer, which is really important, is occlusiderm. Now this is polymerized castor bean oil. It is highly antibacterial, antifungal, antiviral, and castor bean oil is also anti-inflammatory. To that we've added lavender oil, which is soothing and anti-inflammatory and also addresses any possibility of bacterial infection. And we do recommend that the client keeps this on their skin for a good hour after the treatment to maintain protection and a semi-breathable occlusive skin on the barrier on the skin. That also should feel very soothing. Does it feel soothing, Alison?
It's beautiful.
Yeah.
Smell the lavender.
Yeah. And we use the very highest grade lavender, which we know is an antibacterial and an anti-inflammatory as well. So we do recommend the client, obviously, we can't put sunscreen directly on the client's skin at this point, so we recommend that they leave the clinic with a hat and sunglasses so no UV light touches their skin, and no active products until the following day. Maintain the occlusiderm on their skin until the following day. And basically the general rule of thumb is when there's no further signs of inflammation, they can resume their active treatments. Anything else, Katrina?
Just get them to, if it feels warm, they can put a cool compress on, but it usually settles down very quickly.
Usually within a few hours. And that is our collagen induction therapy. Thank you, Alison. Thank you, Katrina.